Yeah. So I'll start with my second free paper, which is actually modulation transfer function and higher order aberrations in eyes implanted with trifocal IOL. It was a sub part of the first study. So again, I don't have any financial disclosures to make for this study. So presently, there are various multifocal lenses which are commonly used for presbyopic correction in subjects with and without cataract, and include bifocal, extended range of vision, and trifocal IOLs. Bifocal IOL provides uncorrected distance and near vision and sacrifices the intermediate vision. Extended depth of focus IOL provides continuous range of uncorrected vision over intermediate to far distances. However, in recent years, trifocal IOLs have gained a lot of attention due to its ability to provide excellent uncorrected far, intermediate, and near visual acuity. And also, it increases the spectacle independence as compared to traditional bifocal IOLs. So the IOL which we evaluated for this study was Acrisoft IQ Panoptics lens, which is only the only US FDA approved trifocal lens. It's a single pin lens with diffractive spheric trifocal design. It's a hydrophobic lens. The only IOL that provides intermediate vision at 60 centimeter, which is typical distance for computer monitors and smartphones. The IOL designed with Enlighten technology that allows the redistribution of intermediate focal points at 120 centimeter to distance, thus results in higher transmission of light, unlike the other trifocal. So what was the need for this study? Because previous studies have reported quality of life and visual outcome parameters in eyes implanted with Panoptics IOL. However, there is limited information about higher order aberration and optical image quality metrics such as modulation transfer function in subjects implanted with Panoptics IOL. So the purpose of this study was to evaluate modulation transfer function, which is basically a ratio of image contrast to object contrast, and higher order aberrations in eyes implanted with trifocal IOL. It was a prospective study done at a western part of the India. Subjects included patients implanted with trifocal IOL, Acrisoft IQ Panoptics, and monofocal IOL Technis ZCB00 was included as a control group in this study. Sample set included 85 eyes with Panoptics IOL implantation and 20 eyes with monofocal Technis IOL implantation. Mean age in Panoptics group was 54.45 years, and in Technis group was 57.50 years. Inclusion criteria was similar to the previous presentation, where we included the subjects implanted with trifocal and monofocal IOL, age group of 40 to 70 years, and best corrected post-operative visual acuity at 1 month of better than 0.2 logMAR units. Exclusion criteria, we excluded patients with pre-op corneal astigmatism of more than 0.75 diopter, IOP of more than 22 millimeters of mercury, any other ocular comorbidities, intra or post-operative complication, cases where swept source optical biometry was not possible, and patients who lost to follow-up before 1 month. So modulation transfer function and higher order aberrations were evaluated using Hoya eye test aberrometer. Higher order aberrations of third order, fourth order, and fifth order were evaluated. Modulation transfer function, which is a software incorporated into eye test aberrometer, was used to obtain the modulation transfer function at special frequencies of 5, 10, 15, 20, 25, and 30 cycles per degree. And all this measurement was done at fixed pupil size of 4 millimeters. In our study, internal higher order aberrations such as coma, trefoil, tetrafoil, secondary astigmatism, pentafoil, secondary coma, and secondary trefoil were similar in both the IOL groups, and it was not statistically significant. And internal higher order aberrations obtained were similar in both the IOL groups. The modulation transfer function at all frequencies were again similar with Panoptics lens as well as the monofocal Technis IOL. So coming to the discussion part, higher order aberrations are small but more complex refractive errors that cannot be corrected by glasses and yet responsible for degradation of retinal image quality. In this study, we evaluated the higher order aberrations that are arising due to the IOL component of the eye, which were similar in both trifocal and monofocal IOL groups, suggesting similar image quality with trifocal and monofocal IOL included in this study. The Enlighten technology used in Panoptics IOL allows the redistribution of light from the first step at 120 centimeters to the distance, and thus allowing maximum light utilization for far distance, and thus minimizing the higher order aberrations. Modulation transfer function is another optical image quality metric that describes the ratio of image contrast to object contrast as a function of spatial frequencies. In the present study, modulation transfer function is the mean of image to object contrast ratio at different spatial frequencies, which was noted to be similar in both the IL groups. So higher order aberration and modulation transfer functions, which are basically pupil dependent parameters, we made the pupil size fixed at 4 millimeters while doing the examination. And previous studies have reported that increase in higher order aberration is associated with increase in pupil size, whereas decrease in the image quality, and thus modulation transfer function with increase in pupil size and spatial frequencies. So to conclude, the internal higher order aberrations and modulation transfer function are similar in panoptics and Technis monofocal IL groups in our study. This finding could be attributed to enlightened optical technology that is used by the panoptics IL group, where majority of the light energy is redirected from intermediate to the distance to far distance, and thus reducing the higher order aberrations and improving the image quality. Thank you.